Hi, I'm Dr. David Hill, and today we're going to talk about how to use a nebulizer for an infant's runny nose. I think that's a little amusing because it's something that we see people try and do a lot. A lot of parents get prescribed a nebulized medication for wheezing. Usually that medication is albuterol, sometimes it's levalbuterol, which is brand name Xopenex. And this is a type of medication which is very effective for relieving the symptom of wheezing. Wheezing is usually associated with asthma, however, sometimes it's associated with upper respiratory viruses as well. Now, the nebulizer and albuterol have no other role in helping children. You might also use your nebulizer, by the way, for chronic asthma therapy, a medication like Pulmicort, budesonide, you might want to use twice a day at your doctor's instruction for a child who has more chronic asthma symptoms and needs to have a daily controller medicine. However, a lot of parents do get confused because asthma and wheezing get worse when children get upper respiratory infections. And a lot of parents aren't sure exactly what the nebulizer is doing for them. They think, well, maybe this thing is for that whole, grungy nose, gurgly sounding cough sort of thing, and they should use it for that. However, it really isn't for that. It's just for treating wheezing and asthma-related symptoms. Sometimes it's really difficult when a child has a cold to tell if they're wheezing or not. I have to use a stethoscope. Often I don't know until I put a stethoscope on the child's chest. So there are some other signs that you can look for to give you a clue that your child is having significant breathing problems. One is to see if they're breathing fast or heavily. Another is to see if the skin is pulling in between the ribs or under the rib cage or over the top of the ribs here at the base of the throat. Those are all signs of significant respiratory distress, and a child who's doing those things really needs to be seen immediately. So, bottom line on using a nebulizer to treat a runny nose, don't do it. That's not what they're for. However, if your child has already been given a nebulizer because they have asthma or wheezing and asthma-like symptoms, then that runny nose may suggest your child is at risk for another asthma attack, and if they're showing any signs of asthma, you're going to want to be sure that they get seen as soon as possible by a medical professional. Talking about nebulizers and runny noses, I'm Dr. David Hill.